Thank you.
I have given you the sharing rights. You can now share your screen, please.
Yeah, and I would like to thank SRM Dental College and Manav Rashna Dental College and Indian Endodontic Society for giving me this opportunity to present a topic on systematic reviews and meta-analysis for library dissertation. And I would like to extend my thanks to Dr. Mahalakshmi ma'am and Dr. Dax Abraham sir for giving this opportunity. So this session is on systematic review and meta-analysis for library dissertation. So this is my institution, Narayana Dental College and Hospital where I work. It's from Andhra Pradesh, Nellore district. So before starting the systematic review, so I just want to say a systematic review is defined as a review of the evidence on clearly formulated question that uses systematic and explicit methods to identify, select and critically appraise relevant primary research and to extract and analyze data from the studies that are included in the review. So basically, you are trying to collect all the articles of the research question and work on that research question and assess the quality of the studies in that review, how good those studies are, or how bad they are. It's like a low risk of bias or high risk of bias, and do an analysis again on that. That's called as meta-analysis, and then come to a conclusion. It's basically called as a systematic review. So before I go into the topic, I just need a small interactive session between the PGs. So I think they can answer in the chat box, no ma'am, if I ask some questions.
Yes, sir. So
Yeah.
they will be in the chat box.
Yeah, fine. Thank you. So my question is, if when you are planning to buy a mobile phone at the cost of 20,000 rupees, what will you do? I just need an answer from all the PGs. Let it be right or wrong. If you type in the chat box, it will be good for me to go to the next slide. If you are planning to buy a mobile at the cost of 20,000 rupees, what will you do? Like which websites you check for or anything like that? What will you do? Neither most of them have answered me Flipkart and Amazon. But when I go to the Amazon or Flipkart under 20,000 rupees mobile, I'll get Realme or Samsung, whatever is coming to me, it will be there on that. But my question here is, if I go to Amazon, each and every mobile phone I have to review it, right? I have to review it. Then how can I compare those things in under one website? Now I have 10 mobile phones. When I look in the Amazon, 10 mobile phones are there for me. All 10 mobile phones are coming one by one. So how can I compare all the things? How can I compare everything together, which has a better RAM or better storage, everything? How can I do that one under a single one? Amazon individually I have to check. Again, I have to go to the Flipkart, which is giving a better price. Is there anything which gives me everything together in one website so that I can compare all the mobile phones which has a better RAM and better viewer experience, screen size, everything? Someone has told Gadget Guru or compare it on Google, GSM Arena. Yeah. So these are the websites where you can compare the mobile phones. Not that one phone will be there. You can compare all the phones, however you want, select that one and compare and then see how good they are, whether your specifications are matching for that or your GB, what you are looking for, the storage is matching for that. So everything under one thing rather than Amazon or a Flipkart, you can look at the GSM Arena or Gadget Guru, go there and compare all the phones. So, right. So, when you look at this as in the first two presentations, they told that this is the hierarchy of the evidence where systematic reviews stand at the highest level of evidence. Where your research question will have more weightage when you are conducting a systematic review. So basically you have two things. One is a literature review, another one is a systematic review and meta-analysis. Whereas in the literature review, you are not going to look at What analysis is being done? Nothing. You are going to just summarize the topic of interest and present it over there. That becomes your literature review. But whereas when it comes to systematic review, you just take a research question and format a PICO analysis, and then define the search strategy, how you are going to include and exclude the articles, and then assess those articles which you have included, and then tell that how those articles are, whether they are a low risk of bias or a high risk of bias, and then perform an analysis on the quantitative data that becomes as a meta-analysis. So literature review doesn't say that whether what you are talking on a particular research question, you are generalized talking on that area. You don't have any proper research question, something like that. Say, for example, calcium hydroxide, a review. So whatever is there on the calcium hydroxide, you are going to talk in that literature review. But whereas when you're talking on a systematic review, you cannot talk like that, stating calcium hydroxide. You need to have a proper research question saying that is calcium hydroxide good for healing of the periapical lesions with non-surgical endodontic treatment. So you are defining the question, and then whichever studies are addressing those questions, you will include those articles, and then see that how those studies was being conducted, whether they are randomized clinical trial or cohort studies or retrospective cohort studies or prospective cohort studies. You include those articles and then combine those data, and whether the studies which were conducted are in a good quality of studies, like a low risk of bias, high risk of bias, and then come to a conclusion that becomes a systematic review. There is a lot of difference between a literature review and a systematic review. So basically, in the narrative literature, you have many questions and there is no search methods and no inclusion criteria and no combining studies, and prone to random and systematic error, and it provides a conflicting summaries. Whereas your systematic review, it has only one question and it has an explicit research and which can be reproducible, and inclusion criteria will be there, and combined study results, which becomes your meta-analysis. When you are going to combine all the study results, it is going to be your meta-analysis. So basically, as a systematic review for first year postgraduates, how do you help you for in your first year, or systematic reviews in a general information? So how much helpful is a systematic review for first year postgraduates? See, for example, your guide gave a research question to you and asked you to collect relevant articles on that research question. What you're going to do then? That A is search Google database, get relevant articles. B is search PubMed database and get relevant articles. C is search PubMed database and get a systematic review on that research question. So what you're going to do? If a guide asks you to get relevant articles on that research question, so what you're going to do? So you can answer in the chat box. Yeah, I can see A, B, C, but instead of searching in the Google database, PubMed is a database for scientific articles related to the medical and dentistry. It's a bigger database where you get all the articles related to the dentistry. That is one of the database, and you have other databases also like Google Scholar and Scopus database. But initial search as a first year postgraduates, you can do the search in PubMed database, and it is better you get a systematic review on that research article, so that you get most of the information that has been published. Then to get forward of your research, it will be very helpful. I'll just show you. So for example, I'm trying to look at a success of dental implants with immediate loading versus conventional loading of fixed prosthesis. Basically, my intention is I just want to check the immediate loading success of implants with that of convention loading or fixed prosthesis. So what I have to go to do now? Basically, if you ask me, now I'm a first year postgraduate. So I just want to place an implant and immediately place the crown on that. That becomes my immediate loading. Or conventional way, place the implant, wait for 3 to 4 months, like means 8 to 12 weeks. Uh, then again place the crown on that fixed prosthesis. So, and after that, comparing these two things, immediate loading implant versus conventional loading implant, how good they are is my research. So before starting my research, so what if I want to do, like uh, already the data has been published, what should I do then if I want to know to whatever extent the data has been published, and then from there that point how to proceed. So which is the best way for me to get the articles? What should I do? Which is the best way for me to get the articles? As I said before, so when you're planning to buy a mobile phone, you are going to do in GSM Phone Arena or something better website. So here I'll go to the PubMed and place the question like success of immediate loading implants and success of conventional loading implants. If I type like that, then I'll get a result. So, so immediate loading and conventional loading, I'm going to get 646 results. And I further refine that result saying that immediate loading and conventional loading and a systematic review. If I type it like that, I'll get 52 results. And then data related to immediate loading versus conventional loading implants is available in one article on this systematic review. See, if you look at this article where I have mentioned immediately versus early or conventional loading dental implants with fixed prosthesis, a systematic review and meta-analysis of randomized controlled clinical trials. As ma'am told in the first presentation about the types of the study designs, randomized controlled clinical trial standards as a golden standard for any research question to be addressed in the intervention part. If you are looking at any intervention type of studies, the best way to address those studies is randomized controlled clinical trials. So when I get to see this article, when I get to see this article, when I get to see this article, basically in this article, totally 49 studies has been included. Totally 49 studies has been included in this article. And if you look at characteristics of the included studies. For every systematic review and meta-analysis, there is a table called as characteristics of the included studies where they define all the studies which they have included properly with the, like you look at this study name and the country where it has designed and what type of study is that, what is the follow-up, what is the age group, how many number of patients, implant how many, and then test and control how many, and what type of implant is there, and what is the loading time of the control group they have checked. So all these details will be there. So now if I want to do research on immediate and conventional loading of the implants, then if I do the similar one what has been published, then I do without checking these things and I do a study. Where do I stand? Where do I stand? Because almost without my knowledge, I'm replicating the study that has been already published if I don't do a proper review of literature. So the basically, when you're looking for the review of literature on a particular research question, try to get a systematic review on that particular research question. Then you will know what sort of studies has already been published in the research. And then after that, how do you improve your study? I don't say that you need to stop the study because it's already published. No. So now if you ask the same question to me, immediate loading versus delayed loading, so many articles have been published, is that I need to stop those studies right now? No, just look at the data, how they have conducted the studies, and what is the relevance of that study, and then what outcomes they have measured in that, and try to follow a different way of outcomes where you find out a different outcome where This was not measured in the previous studies. So when you look in this one, they have just measured about the, when you look at here, implant survival rate, marginal bone level changes, peri-implant gingival level, plaque index, probing depth, implant stability, and the rate of peri-implantitis or peri-implant mucositis and subject feeling of patient. All these things they have measured, and you feel that nothing can be done after this, then look at the intervention. All the companies has been tested, or a new company you are testing with a standard one, then again you can definitely try it out. It is not that once it is been published you cannot do again a new a similar one, but you can try it out a different methodology and different outcome with the same research question, then definitely you have a weightage on that. And one systematic review is already published means, and again after 3 to 4 years there will be sometimes update of the systematic reviews will be there, where a new randomized control trials where it was done, they will include all those new randomized clinical trials and perform a systematic review. So all the possible outcomes related to this research question is presented in one article, and 49 randomized clinical trials were included in the systematic review, and all the related data of these 49 randomized clinical trials were present in one single article, and it is easy way of reference to all the articles. So when you are going forward with a research, if you are getting a similar research question in the systematic review, try to download that article and read that article completely. Then you will understand where the research was for that particular research question, and then you can address the newer one or changes in the existing study what you are planning, and you can see the lacunae of the published studies and fill that lacunae in your research. So basically, when you are trying to interpret a systematic review article, you have, these are the contents of those articles. You have a title, you have a research question, and you have a PICOS, and then inclusion criteria, exclusion criteria, Prisma flow diagram, characteristics of the included studies, and then results includes of risk of bias, results which includes the risk of bias, and then forest plot diagram, and then discussion, and then conclusion. So basically a systematic review article will have all these components. One is the title, a research question, inclusion criteria, exclusion criteria, Prisma flow diagram, characteristics of the included studies, and the results included that can be risk of bias, and the forest plot diagram, discussion, and conclusion. So effect of preoperative corticosteroids in patients with symptomatic pulpitis on postoperative pain after single visit root canal treatment, a systematic review and meta-analysis. So this is the first systematic review of our team got published in 2018 in JOE. As Sir said in the previous presentation, that when the area of interest and there is find that there is a lacunae, they will publish it within no time. So this happened for us. Within 1.5 month time, they have published this article. They found out some errors in this. They asked us to improvise in the corrections, and then within 1.5 month, the article got published in Journal of Endodontics. So basically, the question is, what is the effect of preoperative corticosteroids in patients with symptomatic pulpitis on postoperative pain after single visit root canal therapy, a systematic review and meta-analysis. In this study, we have seen all the studies which have done randomized clinical trials by giving a preoperative corticosteroids in patients with symptomatic pulpitis and done the root canal therapy and then evaluated the postoperative pain. So in the similar way, whoever has done the studies, all those study designs we have included in this systematic review. And then we make sure that we included the randomized clinical trials as our inclusion criteria. We are not going to consider cohort studies or cross-sectional studies or retrospective, whatever observational studies in our study design. In our systematic review, basically we are looking at higher level of evidence, that is randomized clinical trials. But if you ask me a question, that is that we always have to include only randomized clinical trials and perform a systematic review? No, It is not necessary, because as the research question, sometimes you cannot address only randomized clinical trials for that research question. Maybe someone would have done only cohort studies or prospective cohort studies or retrospective cohort studies, like that. So if you feel that for your particular question, it is not possible for include only randomized clinical trials, then you can include cross-sectional studies, or you can include cohort studies, or you can include case control studies and perform a systematic review. So basically, a systematic review is a collection of all the studies. It can be case control studies only based on your research question, or it can be collection of all cohort studies based on your research question, or randomized clinical trials based on your research question. There's a question: if a similar study with a similar methodology but a slightly different outcome has already been published 4 years back, can we submit that article for systematic? Yes, if a research question, a similar systematic review has been published 4 years back, and you are looking at a slightly different outcome, and you have a different articles which were included in the previous systematic review, you can always take up the systematic review. Nothing wrong in that. But see that the outcome, how much it is different, and what you are trying to give clinical relevance with your outcome. And if this outcome was not being published in the previous systematic review, then you can take the systematic review. Is that clear, doctor? Yeah, okay. So it is not that only randomized clinical trials need to be addressed in the systematic review. Sometimes your question requires cross-sectional studies, and sometimes your question may require cohort studies. You combine all those things and then make a systematic review. But when you look at some of the articles which got published in prosthodontics, they will be combining in vitro analyses and randomized clinical trials also. So when you are trying to, and especially in dentistry, some areas we cannot have clinical studies where we have to undergo only in vitro analysis. But when you look at in prosto literature, they have some articles which got published with in vitro analysis, and they may combine that data with clinical studies also. When you are planning to combine data in that way, but don't try to combine data together, but combine the data for in vitro analysis separate data and clinical studies separate data. But as per my thing, I have not seen much articles in endo, but in dental traumatology, when you look at avulsion related studies, where it is difficult to get randomized clinical trials, because you cannot ask the patient, when the patient comes in trauma with avulsion, you cannot randomizely generate to milk transporting media and saline transporting media, which is highly impossible. So you can only see a retrospective cohort studies. So there they can combine the retrospective cohort studies and do a systematic review, or sometimes comparing the media in vitro analysis, like finding out the PDL viability in vitro analysis, combining those in vitro analyses and then combining the retrospective cohort studies. Some articles have been published in dental traumatology on avulsion. So you can, but if you need planning to do in such type of studies, take an example published article with you and then read that article properly, and then you will get a better idea how to combine the data and then go ahead with that. But if you feel that no clinical studies will be there for that question, and then take only in vitro analysis and do a systematic review. So, so the research question is, what is the effect of preoperative corticosteroids in patients with symptomatic pulpitis on postoperative pain after single visit root canal therapy, a systematic review and meta-analysis? So sometimes the questions can be of different types. It can be an incident type of question, or a prevalence type of question, or a therapy related question, or a screening related question, and a diagnostic accuracy related question, or a prognosis related one, and it can be harm related or etiology related. For example, what is the proportion of the population is newly diagnosed with this problem? That becomes your incidence related one. and what proportion of the population is currently living with this problem. That becomes a prevalence related question. And what should be done to treat this problem? That becomes a therapy related one. And will early detection of this problem make a difference in my health? That becomes a screening related question. How good is this test at diagnosing this problem? That becomes a diagnostic accuracy related one. And what is the likely outcome of this problem? That becomes a prognosis related question. And will be there any negative effects of this intervention? That is an harm related one. And what causes this problem? That becomes a etiological related one. The similar way, for example, I have previous question was related to the intervention, so it becomes under the randomized clinical trial. So if I'm looking at other prevalence of the disease, that becomes a prevalence related question. So these things, that question what you are formulating will also decide the type of the study design which you can include in your systematic review. So basically, as a researcher, the question should be formulated properly and then interpreted into the type of research question, and then only we'll go to the next one, that is with the PICOs. That is with the PICO. That is P is population, I is intervention, C is comparison, O is outcome, and now this is yes, PICOs, yes is study design. What type of study design, what we are going to include in that. So when you look at this systematic review, we have taken patients with symptomatic pulpitis is our population, and intervention is preoperative medication with corticosteroids and single visit root canal therapy. We have defined that one also. If it has been done in 2 visits, we are not going to include that one. So we have clearly defined this intervention is preoperative medication with corticosteroids and single visit root canal therapy. And comparison is preoperative medication with placebo or other drugs and single visit root canal therapy. So you can compare with any other drugs, but again it has to be done in single visit root canal therapy. And the primary outcome is the percentage of patients reporting a clinically significant reduction in pain. So the articles which has found out the post-operative pain reduction as in their outcome, that will be included, and any difference in pain scores between groups will be validated by using a pain scale and the percentage of patients requiring rescue analgesic medication. Basically, if at all they have used any rescue analgesic medication as their primary outcome in between that, so those things are also being included. And then secondary outcomes is the amount of analgesic medication required in the first 48 hours and any adverse effects were reported in the first 48 hours. So these are the PICOs for this systematic review. So we have clearly defined the PICOs, and then once the PICOs has been determined, then we will go with the inclusion criteria. So the studies were randomized controlled trials and there is no language restriction were followed in the search strategy. The inclusion criteria was as follows: randomized clinical trials, adults with symptomatic pulpitis with or without apical periodontitis, and comparison of pre and post-operative pain was performed using a validated pain scale, and studies reporting both vital and non-vital teeth but giving data separately for vital teeth, and patients who has undergone single visit root canal therapy, and patient who received preoperative corticosteroids and measured postoperative pain at different time intervals until after 48 hours. So these criteria, whoever has defined in their studies, I'm going to include those studies only. If it is a cohort study, I'm not going to include that study. I'm going to use it as an exclusion criteria. So in that way, we have defined clearly about the inclusion criteria, and the exclusion criteria were studies with more than one visit for root canal therapy and pulp pathosis involving non-vital teeth. So if it is a non-vital teeth and they are doing a root canal therapy, if it is more than one visit, then we are going to exclude those studies in our systematic review. So basically, different types of study designs we can include in the systematic review. As I said before, you can collect all the case control studies, or you can collect all the cross-sectional studies, or you can collect all the cohort studies, or you can collect all the randomized clinical trials. So what type of study design need to be included in a systematic review? A cohort study, case control study, cross-sectional study, randomized clinical trials, all of them. What is your answer for this? Yeah, correct. It's all of them. Fine. Okay. So this is how you will get a Prisma flow diagram where, yeah, all of them. I'll get back to another question shortly. Yeah, can you see my screen, Prisma flow diagram screen?
Yes, sir, we can see.
Yeah, thank you. Okay, so this is how you have to create a Prisma flow chart where you how many articles you have identified and how many you have removed the duplicate and how many you have screened and excluded them, and finally how many you have used for qualitative synthesis, that is called as systematic review, and finally how many you have used for quantitative synthesis, that is called as meta analysis. So if you do a qualitative synthesis, qualitative means how good is the study, that is called as systematic review. And when you are not able to do a quantitative analysis because of the heterogeneity of the data and you are going to stop the study there itself, that becomes a systematic review. But whatever you have included and you see that you have to do a meta analysis, that is data analysis of the included studies, that becomes the quantitative synthesis, that is called as meta analysis. So all systematic reviews do not have meta analysis, but all meta analysis will have a systematic review. So basically, all systematic reviews are not meta-analysis, but all meta-analysis are systematic reviews. So when you do a qualitative synthesis and stop the study, that becomes a systematic review. But whereas you do a meta quantification of the data and perform a forest plot diagram, that becomes a meta-analysis. So when you look at this characteristics of the included studies, so all the articles what we have included in the qualitative synthesis, those we have made a characteristics of the included study. When you ask me, sir, is that mandatory? The characteristics of the included studies table should be similar to whatever has been previously published. No, no, nothing like that. It is up to you. How do you create the table as a researcher? You want to convey the information to the reader, and what is the important information in that review you want to portray to the reader. So you make a table. So in this one, what we felt is we want to look at the sample size, sample teeth, what type of teeth, and then what type of diagnosis they have done, and what is the interventional drug they have used, and what is the route of administration they have followed, and what dosage they have done, and what is the time of preoperative dosage control they have done before starting of the treatment, what outcome variable they have measured, and what is the time interval of evaluation of the pain they have followed in those studies, and is there any rescue drug to relieve the pain they have mentioned, and then baseline VAS scores anyone has mentioned, and all these things, and then finally about the results. All these things we have made a characteristics of the included study table. We felt that these things are appropriate when any reader is seeing this article, and that will act as a useful information for them for this systematic review. So there is no hard and fast rule that these things should be there, but basically as a researcher, you should know what content you need to give in the characteristics of the included study table. So this is the risk of bias of all the articles what we have included. Out of those 5 articles, we have done a risk of bias. So we have followed the Cochrane risk of bias tool for the randomized clinical trials of those which were included in the study. So about this, how do you generate this one? It's a totally a different workshop where I cannot tell in this half an hour thing. So basically, you need to assess the risk of bias of randomized clinical trial with the help of Cochrane risk of bias tool. So if you look at any articles, either in prosto, perio, or conservative, when you are seeing a systematic review, you go to if they have done the randomized clinical trials inclusion in that, when you go to the qualitative assessment, either they would have done with the help of Cochrane risk of bias tool, that is called ROB. Now latest one is Cochrane risk of bias tool 2, ROB2 tool. That's a very lengthy one. It's not possible to tell about that. So ROB risk of bias tool is the basic one which they use in for randomized clinical trials. So as I said, all meta-analyses are systematic reviews, but all systematic reviews are not meta-analysis. So my next question is risk of bias tool same for all types of study designs? Yes or no? Is risk of bias tool, as I told you in the previous slide, that we need to assess the quality of the studies with the help of a risk of bias tool. And for that, we need to have a tool for randomized clinical trial. That's why we call it as a risk of bias tool. So that is called Cochrane risk of bias tool. Is that the risk of bias tool is same for all type of study designs? No, most of them have answered me no. Yes, that is correct answer. But can anyone tell me a simple way why it is not no? That's correct answer only. Why it is not no? Why it is no? Why you cannot compare all the study designs with one risk of bias tool? Can anyone tell me? Can you type why we cannot compare a risk of bias tool for all the study designs? So basically, yes, someone has answered. Well, let me check. Let me check. Yes, exactly. Because of the study designs are different, we cannot compare all the study designs with one risk of bias tool. So basically, we need a different tools for different study designs. So yes, bias will be different for different study designs, where different tools are there in the literature, where you have to do those tools for risk of bias. So basically, these are the different types of risk of bias tools. That Cochrane risk of bias tool is for randomized clinical trial, and Newcastle whatever scale, that is for observational studies. You have different tools are there in that. For cross-sectional, you have NOS cross-sectional scale, and for cohort studies, you have NOS cohort scale, and for case control, you have NOS case control scale. So three different scales are there from NOS, that is Newcastle whatever scale, for the risk of bias. And at the same time, JBA risk of bias tool for all the study design, for case reports, for cohort, for case control, cross-sectional and randomized clinical trial. JBA is another body, John Briggs Institute body, that they have a different risk of bias tools, where you can use these two tools for qualitative assessment of your included studies, and it is not the same for all the study designs. So when you are including case control studies and cross-sectional studies in your study design, better do a separate qualitative assessment for a case control and a cohort study. Don't combine all together, and it will be conveying a wrong message. So you need to categorize the studies and then assess the risk of bias separately for case control and as well as for cross-sectional. The most of the time, when you get a higher level of literature, that is randomized clinical trials, around for your research question, 15 are there, and you are seeing cohort studies also in that. As such, when randomized clinical trials are already published, including randomized clinical trials make more authenticate than again including cohort studies and randomized clinical trials. So you have a gold standard studies which have been published. So try to include those studies only in systematic review. But if you don't have a randomized clinical trials, you have only observational studies, the cross control, case control or cross sectional and cohort studies, are including all observational studies, then categorize separately and do the risk of bias separately for each type of study design. So once you have done those data, and then finally you are going to generate a forest plot diagram comparing. So for my thing, I have a prednisolone which will be compared with placebo at 6 hours time period and 12 hours time period and 24 hours time period. So if I look at 6 hours time period, three authors, Elkadam, Jalaseda and Praveen et al. All the three authors as compared prednisone versus placebo at 6 hours. So I have done the forest plot diagram. We have done the forest plot diagram, and when we look at it, you see this favors prednisolone and favors placebo. This diamond figure, that is favoring the prednisolone. When you see this line of effect, this diamond is towards the prednisolone. That's why all the studies say that this prednisolone, when used pre-operatively, patient is having a less post-operative pain when compared to placebo at 6 hours time period. And three articles has contributed to this data. And you see this size of the boxes, this size is bigger means the sample size is more, the size is smaller means the sample size is less. And this one is more towards the line of effect, whereas the other two is mostly towards favoring the prednisolone. That's how you have to look at the forest plot diagram. When I look at the prednisolone versus placebo at 12-hour time period, again I have these three authors who has contributed the data and says that prednisolone is favoring the patient with less post-operative pain when compared with placebo. So in this way, when you can able to combine the data and you generate a forest plot, that becomes a meta-analysis, which is called as quantitative analysis, Similarly, I have a prednisolone versus placebo at 24 hours time period. The same three articles have contributed to the meta-analysis, which again favors the prednisolone only. So this becomes my forest plot diagram, that is my meta-analysis. So the same thing, prednisone versus placebo at 6 hours time period. So, and conclusion, which is relevant to my systematic review, as sir told before, it should be precisely to your study. So within the limitations of this review and meta-analysis, it can be concluded that preoperative administration of single dose of corticosteroids such as prednisolone and dexamethasone in symptomatic pulpitis can reduce the incidence of post-operative pain after single visit root canal therapy in the short term and reduce the intake of rescue medication with no incidence of drug-related adverse effect. So this is the conclusion of our systematic review, where we said that in symptomatic pulpitis patient, if you can give a prednisolone or dexamethasone 30 minutes before or pre-operatively, it reduces the post-operative pain and reduces the intake of any analgesics. So I just show you an example of randomized clinical trials. Now I'll just show you an example of longitudinal studies where they have compared the cardiovascular disease, the impact of cardiovascular disease and endodontic outcome, a systematic review of longitudinal studies where they have included longitudinal cohort studies. They have included the longitudinal cohort studies and they have done qualitative synthesis for 3 articles and then meta-analysis again for the 3 articles. So this is their meta-analysis, favors the control rather than the experimental. This is their meta-analysis. So in the results, they have mentioned about the Prisma guidelines, 3 articles met, and then figure 2 presents the meta-analysis with the relative risk ratio, and then that one. And the estimation is done with the grade, but they have not shown any the qualitative analysis. I think grading they have done. That is one way of again table 2 for the grading. So this is how you can go with longitudinal studies also, with the cohort studies also. So it is up to the researcher how you are going to take the data and then how do you represent the data makes the difference. So you have an information of systematic review for clinical application. Basically, you cannot see that what is that, why we are taking up the systematic review. Basically, any systematic review will have a relevance for the clinical application. So that is for the first year postgraduates. You can take it for library dissertation. Will be useful, as in the previous session also sir has told about the area of interest. That makes very good sense. If you can able to select the article correctly, the research question in your area of research, and then do a library dissertation and go forward for the dissertation, and it gives a very good information about the published data on that research question for you, and then you can publish it your systematic review at the earliest. You can publish it at the earliest. That is very, very important, because cryotherapy, in the previous session also sir has discussed, one of my PG has done in 2017 and passed out in 2020, and she has not published any data still now. That what is the meaning now if I send for publication? So it becomes outdated. Many people have already done. In 2017 when it was selected, and by 2020 it has to be published. but after 3 years also it has not been published. So the importance of the selecting the article lies, that is one important one, and getting it published at the fast. If you are sending it after 5-6 years, many authors would have published on the same thing. Your information will become outdated. But we have send it immediately once you have done that. Maybe it is a very useful information and they can accept it with minimal corrections and then ask you to resubmit it. So the interest what you are showing in selection of the study, you have to show that in publication also. So basically, why the systematic reviews will be undertaken other than first year graduates? It provides date summary of all available evidence and allows large amounts of data to be assimilated, and so that the findings can be incorporated into evidence-based healthcare. And the systematic reviews can show which treatments and prevention methods have been proven to work and what remains unknown. And they are important for pointing to areas where more research is needed. And systematic reviews are the basis for what is often called evidence-based medicine or healthcare. So basically, who benefits by a systematic review? Individual doctors, researchers, patients, consumers, guideline producers, and policymakers, who all undertake the systematic reviews. Independent authors like academic researchers, clinicians, Cochrane collaboration, you can do a systematic review. That is the largest international organization that conducts systematic review. And health policy making bodies like professional societies, government, etc., to implement anything like pulse polio drops, they do a systematic review and come to a conclusion and then take up these government policies. And pharmaceutical companies. So this is the Cochrane library. When you go to the Cochrane library, a single best place to find independent, high quality evidence for healthcare decision making. And the stages, what are the stages of a systematic review? Develop a focused research question and define inclusion and exclusion criteria. Search the literature, select the studies, assess the study quality, extract the data, analyze and present the results, interpret the results and draw conclusion, update when it is necessary. So getting started with a systematic review, define the research question properly, clear background, scope, setting, and review the question which determines the PICO analysis, and specify which inclusion and exclusion criteria are needed for that systematic review. So the research question should always guide the author in working through many stages of the systematic review, like defining inclusion and exclusion criteria, searching the literature, and selecting the studies and extracting the data and analyzing and presenting the results. So the research question is very, very important when you are performing a systematic review. So these are the recommended databases for you to search for the systematic reviews or your studies: PubMed, Embase, and Cochrane Library, Scopus, and Web of Science. These are the recommended databases. So take home message: clearly framed research question with proper study design of included studies gives a good systematic review. So you need to clearly frame the research question with proper study design of included studies gives a good systematic review. And this is my email ID. If you have any doubts, you can contact me at this email ID. And I would extend my thanks to SRM Dental College and Manav Rachna Dental College for giving this opportunity. And session is open for the doubts. Thank you, ma'am.